Welcome, dear students. Before the revision, we are taking the last class. After that, revisions will start, and your exam will start on 27th, as you know, sessional 2 exam. This will include the unit 4, 5, and 6 in HVAC. Unit 4, 5, and 6. The questions will be same type as it is generally formulated. First question having 5 parts A, B, C, D, E, each of 2 marks, and it is mandatory. So 10 marks the first question. There will be questions in 2, 3, and 4. Each question of 2, 3, and 4 you have to answer 2 out of the 3. That's what is important. So we have formulated like that. You can answer the questions. Don't really go to exam. Follow my class lectures and whatever I have told in the class till now. Now, today in the last class, I will be talking about the plant room. Plant room. That is HVAC plant room. That's what I am going to talk about. I am just going to draw it. Now I deal with it like that. I have drawn. There are two chilling machines, and these are chilling machine pedestals. Pedestals means the platform on which the chilling machine is resting. There are two chilling machines having pedestals, and pedestals are made of RCC, reinforced cement concrete. I have shown the sectional view already to you to show how the chilling machine rests on reinforced cement concrete. On the pedestal, chilling machine will be there. This is a made of RCC. This is the platform around a height of around 200 mm, the depth of around 200 mm or 150 mm from the floor level. This is the plan. This is HVAC plant room plan. This is the plan. So this on this pedestal the chilling machine will rest. On this pedestal this chilling machine will rest. So there are two numbers of chilling machine, and each chilling machine will have one condenser pump pedestal, condenser water pump pedestal. CDW means condenser water, and one chilled water pump pedestal. CHW means chilled water pump pedestal. Then again a condenser water pump pedestal, chilled water pump pedestal. On these pedestals the pumps will stay, and the pump I have not put the pump weight because pump weight will depend on the pump side, and this dimension is within this 1000 mm of the chilling machine, as it is apparently evident. And this is what 1000 mm is the pedestal length we have taken for each of the pump. This is 3000 mm. These all dimensions in mm. Remember, dimensions in mm. All dimensions are in mm. So this is the chilling machine with the 3000 put here, 1000 put here, 600 gap here to move around for maintenance purpose, 850 gap here to move around in between them for maintenance purpose to chilling machine pedestals, and then 1000 mm is the width of the chilling machine pedestal, and 3000 mm is the length of the chilling machine pedestal. In case of condenser pumps, 1000 mm is the length, width depends on the pump side. This cannot be determined exactly. On the pump side it will vary, but it won't be more than 300 mm generally. So unless the pump is very big. So in this arrangement we have shown the total plant room drawing. This is the HVAC plant room drawing. In plant room what you are having? Mainly chilling machine valves, pumps, pump valves, all these things. So you will be having this chilling machine valves, pump valves. Then the arrangement is for pedestals. Remember, these are pedestals. These are not chilling machines. Pedestals are RCC structure of platform made on the floor on which the chilling machine will rest like that. The chilling machine will rest like that, chilling machine will rest like that. The pedestals will put the location of the chilling machine, how much you should take for the pedestal, that determines the plant room. About this chilling machine, how it is, this is the plan. In the section how it is resting on pedestal, I have already explained in earlier drawing where I have shown the pedestal is of RCC structure, and on that the chilling machine is resting. In earlier classes I have shown with the drawing about that. This is about the total plant room drawing. This talks about the whole plant room. This plant room wall has a 1000 mm gap with the chilling machine pedestal, so that a person can easily move around, can take care of the valves. Here are valves also, those will be coming, valves. Here will be valves also, those will be coming. The distance between chilling machine and pump is around 1000 mm. Now I tell you, these dimensions are approximate. And these dimensions will vary depending on the size of the chilling machine, size of the chilled water and condenser water pump, and all these things. This is just to give you an idea how the plant room will look like. It depends on number of chilling machines, it depends on number of chilled water and condenser water pumps. That determines the total plant room size. But plant room size will be something of that sort, as I am explaining to you. You can see in front of you. This is the chilled water HVAC plant room plan. I am defining the total plant room so that it is clearly visible and understandable to you. Any question you have on this, you can ask me after the class. This is about plant room. Now I'll tell about hospital positive and negative room pressures. You get an idea when I am talking about that? Now, we have positive and negative rooms in hospital. There are some rooms in hospital which are patient rooms which are kept under positive or negative pressure. You can see different positive and negative pressures I have shown here. In the room, we maintain a positive pressure or negative pressure. How do we maintain? We produce more air, we supply more air here as compared to outside, and it remains positive. Say example for positive case. Wherever it is positive, in positive case, we maintain more pressure here. That means we supply more air here as compared to this is the corridor or outside, as compared to the pressure here. So this remains in positive, this remains in negative. In case of negative pressure, we supply less air here, more air in the corridor. This is the door of the door. So this is the negative pressure, this is the positive pressure. That means we supply less air here, more air here. So when you open the door, air enters inside. In case of negative pressure outside, what happens? When you open the door from positive, the air goes outside. Here the airflow direction is, in case of positive, inside negative, inside is negative is like that. This is the airflow direction. In case of positive, this is the airflow direction. In case of positive, this is the airflow direction. In case of negative, this is the airflow direction. Try to understand what I am doing. I supply more air here, it becomes a positive pressure. Here more air I supply through HU as compared to what I supplied in the corridor of the room. This is the patient room. So this becomes positive, this becomes negative. If positive pressure, the air will flow outside as soon as you open the door. In case of negative pressure, I supply a less pressure here, less air here, and supply a more pressure here. So when you open the door, as a result, air will enter inside. I have shown you the arrow marks, the flow of air. Now, why these are such different negative and positive pressures? In case of AIDS patient, the main problem is that AIDS patient has no immunity. So even with a simple cold or cough or simple sneezing, they may die. So because of that reason, we put the AIDS patient room in positive pressure so that the air from inside goes to outside. So that there is no infection or virus coming from outside to inside. Because if it comes, the patient will die. If he is infected by anything, the patient will die. This is in case of AIDS patient room. Similar positive pressure in case of bone marrow transplant room. Bone marrow transplant, when it happens? It happens when there is blood cancer. In case of blood cancer, the bone marrow transplant is done of the patient. When the bone marrow transplant of a patient is done, for another 20-21 days, he remains in extreme fragile condition. Any small infection may kill that person because his immunity level drops. For that reason, in bone marrow transplant room, we keep a positive pressure so that whenever you open the door, air flows from inside to outside. So that no air comes inside. The main intention of positive pressure is that no air comes inside. That means no virus, no bacteria should come inside to cause any infection. It will remain at positive pressure. Now we come to COVID-19 patient, which is at present the dominant scenario in the world. In the COVID-19 patient case, what happens? The patient can infect anybody who comes nearby. So it is generally kept at negative pressure. COVID-19 patient is kept in negative pressure. Outside is a positive pressure. So that the air can come from outside to inside, but it doesn't go from inside to outside and doesn't affect any outsider. It comes from outside to inside. It's maintained at negative pressure. Similarly, in case of TB patient, tuberculosis patient, he affects or infects others. Because of that reason, his room is maintained at negative pressure, while the outside pressure is positive pressure. So that air flows from outside to inside, and this man does not transmit virus or bacteria of TB to outside. That is the intention. These positive and negative pressures are maintained in all the hospital rooms, and these are very important from air conditioning purpose because this gives the proper health care of the patients as well as the visitors as well as the doctors and nurses. In case of hospitals, you are maintaining these pressures. You understand when you enter certain rooms of the air, say you are entering a room of a positive pressure, in AIDS patient's room or a bone marrow transplant room. When you enter through the door, you will get a gush of air hitting you. You may feel it is just an air conditioned air. It is not because of that. It is because this is a positive pressure, this is a negative pressure. That is delta P is positive air. So as a result, the moment you open the door, the air flows outside and you get the gush of air on your face. Similarly, in case of negative patient room, when you open the door, what happens? The air comes inside. So along with you, air will enter inside. This is the way you can go through the positive and negative pressure. This is important for you. as I have described. This is all about the HVAC syllabus we have covered. This is enough. You have known about HVAC, and I think it will help in the long run for you for getting job and doing other purposes, doing your business and so many other things. From next classes, we'll be doing revision of the HVAC. That's all for today, this lecture. This is the 12th lecture of HVAC I have given. Thank you.